continuing on with the FDA's approval of thermography. I'm here with Dr. Chapman, Dr. Tolmosoff, and here we have peripheral vascular disease and reflex sympathetic dystrophy. This is a big one that thermography can detect and show. Why don't you discuss this one, Dr. Chapman?
It's chronic pain with the reflex sympathetic dystrophy is characterized by cold on the side of the arrow. It's very, very dark blue in this particular fashion. We take a look at the opposite side, the right bottom of the foot, and all the weight bearing now is at the heel, along the arch, right in here, and there's a slight widening of the arch, at which point that's due to altered ambulatory kinetics.
And here we have the KT Weber syndrome, is a congenital arteriovenous fistula, diffuse cutaneous capillary angiomas, and varicose veins occurs in the leg. So you can see the difference between the right and left leg there.
Right, you do see the clear area at the arrow where the vascular pattern is distended, and we see that in the port wine stain with many of the young children. They want to see how bad it is and if they can get it removed or not.
And of course the trigger points. This is an easy one. You can see right in the arrows here.
Right, in this particular patient, a trigger point is a tight muscle, an overused muscle. We see the trigger points here on the liquid crystal plate. On this one here, it's the same plate, but the area is sprayed down with cool water.
To really identify it.
That actually identifies clearly the two trigger point patterns for specific treatment and monitoring.
And here we have musculoskeletal disorder of the spinal segment, L3, L4, L3, L5, L4, L5. It's one of those, L3, L4.
Right, this is used by chiropractors quite frequently. It's due to a decreased interosseous spacing, narrower area here the disc is going. As it goes down, both facets are rubbing, and you get a little splay pattern in the mid-back. It's characterized by increased heat. Again, this is used by chiropractors quite frequently.
Muscular disorder, ganglion cyst.
That would almost always be cold. And you see it's a little lump right here on the wrist. And we see it's characterized by cold or hypothermia on the actual image.
Of course, here we have that right clavicle that was fractured.
This was a jockey from Caliente, and when he fell, the horse fell on top of him. You can see a pulling of the right part of the neck, characterized by some heat over here, but markedly affecting the nerve. It's characterized by a cold shoulder, and that needs immediate attention.
We talk about extracranial cerebral vascular disease, and these are the areas that you tend to look at.
Right, and what happens is that we only pick up 6 millimeters deep in the neck area or any part of the body. Many doctors are saying they can see the carotid artery. The carotid artery is too deep, not possible, but the extracranial arteries will actually branch out from the carotid, so we can pick up an early stroke up in the trochlear region, the temporal region, and the nuchal triangle region in the back.
And just having done one last week where you saw how it just jumps out at you. And again, here's a extracranial cerebral vascular disease, and we can kind of see the difference between the right and left, and one's hot and one's cold when we have a
It's characterized by cold at the trochlear artery here. Green is hot. It's characterized by cold at the temporal area, and that's characterized by brown. And it's characterized by cold at the posterior nuchal triangle in the back of the neck.
And again, here we have the thyroid gland, not one of your favorites, but nonetheless we can pick this up.
Okay. We see hypothyroidism right at the lower portion of the neck where the thyroid would be, and that would be characterized by hypothyroidism. Okay.
And various neoplastic and inflammatory conditions.
Very clearly a breast neoplastic condition. You can't miss the side of involvement, which is the right or red side. Okay.
And that ends our discussion in terms of why doesn't your doctor refer to thermography? Probably the best answer is they just don't know.
They don't understand.
Thank you.